All right, good afternoon, everyone. My name is MJ Scales. I'm joined today by my co-host, Dana Holtz. We're both from the University of Delaware Center for Drug and Health Studies. And today we'll be hosting a 3D. If you've attended these 3Ds before, they are kind of mini sessions which have a primary data focus, and then we have some conversation around it. It really came out of this, the SEOW work group wanting to have opportunities to dig a little deeper into some of the data. And today we're going to be doing something a little bit different. We'll be presenting a few data points, and we've invited some champions from throughout the state to respond to these data points, and I'll introduce those ladies in just a moment. But first, my co-host is going to tell you a little bit about the SEOW and what we do. As we're going throughout the presentations, as questions come up, please feel free to drop them in the chat. As it's appropriate to respond to them, we will. And if we don't get to them today at the end, then we will put those answers together for you when we send out the slides. And we will be sending out the slides and any other resource materials that happen to come up. Dana?
Yes, thanks, MJ. So I want to tell you just a little bit about the SEOW. It's been around in the state for, I would say, 15 years or so. First, it was funded through the Strategic Prevention Framework Partnerships for Success. Then it was the SPIF SIG State Incentive Grant, and then the SPIF Strategic Prevention Framework Partnerships for Success. And now it's funded through the block grant, all through Division of Substance Abuse and Mental Health, DSAM. So we want to thank DSAM for continuing to support this program and the work that we do. Next slide, please. So there's 4 goals of the SEOW, and this is the screenshot from our website, and feel free to go to our website. There's a lot of resources there. The first one is to identify, analyze, and share data. And what this means is that we, every year and periodically throughout the year, we look at local sources of data and national sources of data. So this could be the YRBS, the Delaware School Survey, the Behavior Risk Factors Surveillance Survey, the NISDA, local sources of data like the forensics reports or the DEA drug monitoring reports, et cetera. And we analyze this data and we share this data out. And we also create data products. This includes our rather hefty epidemiological outcomes report, state report, which is on our website, has a wealth of information from a number of data sources, but we also create infographics, gap reports, heat maps, and so on. The third goal is to train our community partners in understanding and using data. So this includes presentations like today, these 3D presentations, our biannual meetings, SEOW meetings that we have twice a year. It also includes presentations where people invite us to come to speak, and we'll share local sources of data, and also data requests. So occasionally nonprofit organizations need help identifying and finding data to support grant funding opportunities, or to share out to their own community members, or for board reports, et cetera, and we'll help those community partners identify and find that data. The fourth thing that we do is build state and local level monitoring systems. And this is the SEOW network that we have. Sharon, Miriam, and I will send out periodic emails through the listserv. There's about 108 members currently on the listserv, the last I heard, representing 46 agencies. And through that, we send out links to national reports, local reports, et cetera. And we also have our biannual SEOW reports. So next page, please. So just to let you guys know, there's a few data reports coming or have just recently been on our website, so keep an eye on them. The annual Delaware epidemiological report is coming very soon. I believe it's just been finished, and that's our annual report. It's about 200 pages. We typically will also post it in chapters, so you can look at it under different topic areas, whether it's opioids or marijuana, et cetera. We also have gap reports on our website, the heat maps, as I mentioned before. And there's a number of infographics too that just recently came out. One's about violence in Delaware using Delaware youth data, and the other one is about LGBTQ plus affirming spaces. All presentations that we have, we often record them, and they're also available on our website. Okay. Next page. All right.
Thank you so much, Dana. I'm going to stop sharing for a second so we can be introduced to our three panelists today, three amazing folks who are doing work in the state of Delaware in this space. First is Barbara Messick. She's the mother of three young children. Each of them has a mental health diagnosis. She spent the past 14 years navigating Delaware's mental health systems to find services for her children, and the last 7 years as a support provider and advocate for other families whose children have mental health challenges. In her role with the Division of Prevention and Behavioral Health Services, she has served as lead family contact and family coordinator, supporting families whose children are receiving services. Ms. Messick is the Executive Director of Champions for Children's Mental Health and sits on numerous committees, including the Lieutenant Governor's Behavioral Health Task Force, to ensure family voice is included in all aspects of decision-making. Ms. Messick, you want to say hello for a minute?
Hello. Sorry, I was having trouble finding that little button there.
Oh,
It moved on me in the past year and a half or 2 years now. Hello, everyone. I don't know what else you want me. She pretty much said it all. So happy to be here.
No worries. And also today we have Sonia Songi, who is a licensed professional counselor, 15 years of experience in mental health.
One of the things we talked about this, and I don't know what, it's so early, I don't think the data's been out, but I know any feedback for help we can get.
Sorry about that. Sonia Songi is a licensed professional counselor with 18 years of experience in mental health. She's a graduate of Montclair State University. I'm from Jersey. I should have said that the right way. With a master's degree in counseling guidance and human services. Sonia served as a behavioral health consultant and coordinator for the Behavioral Health Services Program in Kent and Newcastle County. That program supported the integration of mental health services for students throughout the state in 30 public schools. And currently she is the community project manager for Capital School District through Project Delaware, which is a grant awarded to the state of Delaware to support 3 districts in their implementation of the multi-tiered system of support, including the promotion of youth mental health. Sonia, if you want to unmute for a second and say hello.
Hello, everyone. It's my pleasure to be here today. Thank you, MJ, for that lovely introduction, and I look forward to participating on the panel.
Thanks so much. And last but certainly not least, we have Dr. Chrissy Camarada, who is a board certified clinical child and adolescent psychologist at Nemours Hospital for Children and also a clinical associate professor of pediatrics at the Sidney Kimmel Medical College at Thomas Jefferson University. She's the clinical director of the Clinical Child and Community Psychology Program. She works with youth with eating disorders and is involved in training new therapists to use evidence-based treatments. She serves on the board of the Society of Clinical Child and Adolescent Psychology. She has authored several book chapters in the areas of eating disorders and adjustment to hospitalization. Dr. Camarada, you want to say hello for a moment?
Hey everyone, thank you so much for that introduction. I'm excited to see this work and grateful to be a part of this panel today. So I look forward to listening and learning from you all and discussing this important work.
Thank you so much. All right. If you have any technical issues or issues getting in, please let us know in the chat and one of us will take care of it, okay? All right, so I'm going to go back to sharing my screen. And the objectives for today, first, we're going to look at some using Delaware school survey data. We're going to learn how Delaware youth rated their own mental health or own emotional health in 2021. We're going to discuss who youth consider sources of support, and we're going to examine any disparities in perceived mental health. I do want to make a quick note. I'm not going to read all of this for you, but there were some changes, as you can imagine, with the 2021 Delaware School Survey with the administration. First, in lieu of a traditional paper and pencil format, schools and districts were able to participate online using Qualtrics. The majority of those that participated were conducted or collected via Qualtrics, which is an online survey platform. And then also there is a challenge when we consider trend data across the board. And so there are some challenges that way. We won't get into trend data today. And if you wanted to look into response rates and those kinds of things, we can always connect you with our survey team at the center, and we can dive into that a little bit more. But I do want you to keep that in mind as we consider some of the data that we're going to be sharing, that there are challenges when we consider other time periods. If you're not currently muted, if you can mute yourself, that would be super. Thank you so much. All right, so the first data point we want to share today is around emotional health. And the question that young people were asked is, in general, how would you rate your emotional health? And the blue bars you'll see there are 8th grade, and the greenish bars are 11th grade. And when given the option excellent, very good, good, fair, and poor, you will see that the rates don't change a whole lot between 8th and 11th grade, but you will see that for the most part, respondents rated their emotional health as good, very good, or excellent. However, not an insignificant amount of young people rated their emotional health as fair or poor. So the question I have for our panelists, and I'll just kind of call them out, is, does this reflect what you see among the youth you serve? And let's start with Dr. Camerata, please.
Yeah, I would say that I'm actually surprised that they're reporting that they seem to be doing better than I would have expected. But I would say that the older kids certainly have suffered the most over these past couple of years. I think as kids get more independent, or the expectation is they're more independent and they haven't been able to actualize that, I think they have struggled quite a bit. So I think the teens, I don't think anyone is surprised to hear that they're really struggling over these past couple of years.
Sonia?
I was thinking the same, that the perception is definitely different for our youth and then what we think is going on and what their needs are. This school year, we've seen an increase in needs and services. So hearing that 8th graders, 60% think that they're doing better or fair, good to excellent is not what we're seeing. We're seeing a higher demand in referrals, a higher demand in services, and more anxiety. So I think that, again, that self-report kind of is a disadvantage because sometimes their perception is not indicative of what's really going on for youth. And our focus right now with more trauma-focused trainings in the building so that we can help support youth recognizing that what their perception might be a little distorted because what their normal baseline is may not actually be what's normal. So we're looking to kind of help empower them to recognize the need for services and to seek help.
I think you really raised an interesting point, Sonia, that this data was collected earlier in the year, and now that young people are transitioning back into the building, you would kind of see some of that anxiety manifest of being back into school and what are the expectations and how do I cope and so on and so forth. Ms. Mexon, what are your thoughts?
I have to agree. I'm surprised of the numbers, but again, I actually have an 8th grader and an 11th grader in my home. So, and I know that both of them are really struggling. My 8th grader, through the pandemic, his social anxiety has gone through the roof. Like it's paralyzing to him at times. So to know that he probably was one of those answers, I'm like, he was probably on the other end. But he's also one that doesn't want anybody to know that he's not okay. So he would have answered, oh, I'm good, So I think you got to take it with a grain of salt of, do they understand what they're saying and the impact it's going to have or not? And then my 11th grader, who has always done wonderful, but with the pandemic, her anxiety and depression flared up. So I'm surprised to see the numbers as well, but also, do they really understand what they were doing at the same time?
Yeah, I think you raise a good point that leads us to our next data point, in that people experience things differently based on all kinds of different factors, whether it's their background or what's going on at home. And so those numbers represent a total, right? And the experience of individuals may be very different, right? And I think this kind of our next data point here gets at that a little bit, right? We could have taken this question and broken it down by race, by disability, in a lot of different ways. But for this example, we've chosen to pull out those students who are lesbian, gay, or bisexual in the 11th grade. And when asked that same question, how would you rate your emotional health? We see that their answers are very different, right? Compared to their heterosexual peers. And so for this group of students, 11th grade students, if I didn't mention that already, we see that their rating of their emotional health, fair and poor, are much higher than their heterosexual peers. And that their rating of excellent is quite minimal. So my question for you all is, what is one of the ways that you are promoting equity and inclusion among the youth that you serve? And for that question, I want to start with Sonia.
Well, I think that one of the things, especially with the LGBTQ community plus, we've noticed that even in the middle school level, there's been a greater need. There's more awareness, or students that are identifying and being more expressive, and teachers struggling with how to support, how to address, or how do you skirt that line. So I think that creating safe spaces are one of the things that we've been trying to incorporate. I know we have the GSA at the high school, but really trying to explore advocating for that happening earlier, because we know that this identification happens earlier. And so if we can be able to provide that safe space sooner, student voice is something that we led school year as an initiative of incorporating more student voice. So that was something that we were focusing on, but then we kind of had to shift gears a little bit and get more involved in that trauma piece, because what we're noticing is that the impact of the pandemic and returning to school has been really stressful for our youth. And we do know that the LGBTQ community is at risk and at greater risk for mental health needs. So we're really provided some PD for our staff as well to help support them with supporting the students in real time.
Excellent. That's amazing. How about you, Ms. Messick? What do you think? Uh-oh, Ms. Messick, I think you're frozen. I'm going to come back to you in just a second. Dr. Camerata?
Sure. What comes to mind for me in this question is kind of more of a systems approach for folks who work with these kids from a mental health in the mental health field, and I think about starting with how we approach kids of all different types of diversity, and I think cultural humility is a really important piece of that. And I think when I work with kids who are gender diverse or LGBTQ or racially or ethnically diverse, I talk about creating that safe space and opening up a discussion about our identities and how I identify and how they want to be identified. And so by opening up that conversation, it allows us to sort of make all of those pieces known and explore our biases and other areas that may come up in the therapy space. The other piece to that, I think, is again, for us who are in mental health roles, is really working to make sure that our workforce looks like the kids that we see. And so having a diverse set of therapists that represent the kids that we're working with and making sure that that's a priority. And I think we've not done a great job of that historically. And thankfully, folks are starting to talk more about that and really make that something that we're really valuing and acting on those values.
I think you're 100% correct, both of you. I think it starts with, for professionals, professional development. But Dr. Camerata, you made the point of talking about just having that conversation, just opening the door for those conversations. And Ms. Messick, before she unfortunately dropped off, had that great sign on her wall about sharing your story and not having shame. And I think that's really great, is opening the door, having that conversation. Helps others lead the way through that conversation. If Ms. Messick joins us again, we'll touch base with her about her thoughts on that question. But for now, I'm gonna jump back into the data. And folks, I want to encourage you, if you have questions, please make sure you drop those questions in the chat. All right, so changing gears a little bit and looking at the connection with mind and body. You know, a lot of students throughout the pandemic have struggled, as we know, with mental health, but many of them faced food insecurity, housing insecurity because of parental job loss, or you know, insecurity around access to food, and they were out of the physical building where many students get lunch regularly, or breakfast, or things like that. And so looking at these two data points for, again, this is 2021, on an average school night, 37% of 8th graders and 52% of 11th graders reported getting less than 7 hours of sleep. And these two ages happen to be in two different brackets. You know, I think the older kids are 7 to 9 hours of sleep is recommended from the American Academy of Pediatrics. And for the 13 age range, it's more like 9 to 11. But either way, a significant portion of children are not getting at least 7 hours of sleep a night. And, you know, we know how many of us have throughout the pandemic taken advantage of yoga or stretching or something to keep us physically active, you know, watching videos on exercising and YouTube and our smart TVs, or through our employers, just to get us active and moving. And in the week before this survey, more than half of 8th graders and 11th graders reported being physically active at least an hour a day on 3 days or less. So there are a number of students who are not getting enough rest, and a number of students who are not being physically active, which we know promotes not just body health, but mind health. So my question for our panel is, how can we promote whole child wellness? And I'm going to start with Sonia, please.
I think just, again, affording opportunities to participate in different activities. I know that we do a lot for staff and wellness, and we also invite staff to have their families join in. And there's always all those extracurricular activities at school in our 21st century programming that affords those opportunities to still engage in activities after school hours. So those are some of the things that we're doing to kind of promote the overall wellness, and also mindfulness with eating and yoga. So all those opportunities are being provided for students to participate in. Again, just using their voice to also find out what activities they would like is something that we're striving to include while we're developing plans for students.
Sonia, I'm going to jump in because I know a lot about the great work that Capital is doing, and what I think is what you and Dr. Brown have done to not just focus on student wellness, excuse me, but also to incorporate staff wellness, and how important that is, not just for staff, for adults, but how people who are healthy themselves can support healthy students. And if I'm struggling, it's really hard for me to help children or to help young people that I may be working with, because I'm struggling. So I think that you all have taken a really dynamic approach to wellness for the district as a whole. So great work there. Can you touch a little bit about the couple of things that you all are doing around adult wellness? You mentioned professional development, but I know you all are doing some other cool things too.
Absolutely. So we have drop-in hours for our staff, where there is a licensed clinical social worker that's available from 11 to 1 so that they can drop in and take the opportunity to speak to someone that's not affiliated with the school. This is a contractor outside of the school. So again, just giving them that open free space so that in real time during their day, if they needed a safe place to vent and share what's going on, they have an opportunity to do that. We have yoga, we have Zumba, we have all of those things on a regular basis that they can participate in. We also have book studies with self-care and journaling, again, just to promote that awareness that self-care is instrumental. And like you said, MJ, we know that you have to be self-regulated in order to regulate others, right? So we are really working towards actively getting our staff involved in those activities. So we've done the work with having it there and available. the next piece is having people engage in it. And that's where we're kind of struggling. So, but, you know, again, we're working on promoting and sharing this information out continuously, because we really would like to make sure that the staff is getting the things that they need in order to feel better and self-regulated.
That's great. That accessibility piece is crucial. Dr. Camerata, how would you respond to the same question around whole child wellness?
Yeah, I mean, I think that it's really important to be thinking again on a systems level, that addressing health disparities and the inequities that exist in our world for kids in terms of healthcare, access to food and things of that nature. And so I think if we really want to think about that, I think it has to start at a community level and really working to get these kids and these families the things that they need so that they're able to be screened early for mental health concerns, but also other health concerns. Their parents can make sure that they're healthy. And I also think about, you know, the traumas that most of our kids are experiencing. And when I see the word wellness, so I come from an eating disorders background, and wellness to me is kind of a loaded question, because, or it's a loaded comment, because I think a lot of times it talks about how we eat. And I think that is something that is so challenging for many of the families that we work with, because these kids don't have access to fresh fruits and vegetables. And culturally, a lot of our healthcare providers, you know, may criticize the way that different cultures eat. And some of the weight-based biases that exist in our culture can impact kids and make them not want to engage in movement and many of these activities that we think of as being healthy. And so, again, as adults that work with these kids, we need to be aware of our biases and the way that we approach these kids and the way that we sort of communicate what we think these kids and families should be doing in a way that's sensitive, but doesn't contribute to kids feeling, you know, an otherness from the folks who are trying to help.
I appreciate your comments around, you know, the word wellness. You know, I come from a behavioral health and public health background. And so for me, wellness is the opposite of a deficit model. But for some folks, I know that wellness conjures up images of like fad diets and, you know, yoga pants and this idea that you just need a new supplement and then you'll be well. And that's, I think a struggle sometimes with the language that we use, but I appreciate your comments on accessibility and how our framing of things is important to the ability for us to work with young people and their families, which is a crucial piece of success. I want to share one final data point with you all, and then I want to kind of open it up for any further conversation and dialogue. So the last one is, if you had a problem and wanted to discuss it with an adult, who would you talk to? And this is a mark all that applies. So it may, you know, may be more than 50%. But when we think about the fact that young people are most often in school or most often spending their time in school, it is encouraging to see that more than half of them would turn to a teacher in 11th grade for problem solving and so on and so forth. Guidance counselors are another strong support for young people. Coaches. I was surprised by principals and assistant principals. I'll be honest, when I was a young person, nobody wanted to go and talk to the principal. But it was really very interesting. We have another question on the survey that we didn't dive into this time around who gives you support and encouragement. And you see some of these similar trends, mostly your parents, but also other adults that are kind of in their network, you know, teachers, faith leaders, coaches, so on and so forth. So my question for our panel is, what can adults do to provide safe spaces to work through challenges that they are experiencing? And Sonia mentioned safe spaces before, but what are some ways that adults in like a non-clinical setting can provide safe spaces for young people? And I'll start with you, Dr. Kimra.
Yeah, you know, I think when I work with teens, what I find is they appreciate adults who can be authentic. And so I think that they're going to rely on folks that they feel like they can trust, who are being themselves. You don't have to be the coolest adult around. You just have to be the one that is there, is listening to them, is being affirming, and, you know, reflecting what the youth is trying to communicate. You know, I think a lot of times as adults, we like to ask a lot of questions because we think that that's going to get kids to talk. And we find that asking a lot of questions may not allow kids to really open up. But in fact, what's better is to, you know, share a space with a teen or a kid, and be around, be available, be yourself, and, you know, notice what's going on around them, make comments, and be a presence for these kids. And I find that they're going to trust you more from just that.
I think you're 100% right. That authenticity piece. I tell people all the time when we talk about young people, whether we're sharing information around substance use, kids can smell it when you're not being authentic. They can pick it up. They're like, wait, she doesn't know what she's talking about. So he doesn't know what he's talking about. So I think that authenticity piece is super, super important. Sonia, what are your comments around, or what are your thoughts around adults creating safe spaces for young people?
I completely agree with you with that authenticity piece, like just being real and candid, and also being very aware of their world. I think a lot of times having those open conversations, and when they're using slang and I don't know it, being real, like, can you explain that to me? Help me understand what that means, because it's changing all the time. And as grown-ups, we need to be a part of their world and knowledgeable about what they're experiencing, TikTok, what the new thing is, not being out of the loop, because then you're not relatable, and then there's no need or reason for them to really want to connect with you. I know that in the past, when I was in the buildings providing direct services, I would just have lunch and allow kids to come up, get their lunch. And that lunchtime room became like, I needed a bigger office because the word got out and kids just wanted to come up. And then it was, and I'm like, you don't want to go be with your friends? You really want to come in the office with me? But they felt more comfortable because they had a safe place. They were able to share freely. They enjoyed the open dialogue and being able to relate to an adult. So I think that that was really helpful for me connecting with students at that time. And when they start to trust you, they really self-regulate each other. Like, I remember there was times when someone would say something inappropriate in that lunchtime meeting, and I'd have another student saying, don't you see Miss Sonia right there? You don't say that. And it was like, just creating those relationships made things so much easier. You didn't even have to be the person now giving guidance or redirecting. They would do that amongst themselves. So that peer relationship became very dynamic. And I think that's something that we really need to work more effectively towards, because they listen to each other. And we know that that's the biggest influence for youth is their peers. So if we really started to hone in on developing those leadership skills, and in a positive way, because we know that they're, born leaders, and sometimes they can lead down the wrong path. But if they had that trusted adult to kind of gear them up to lead in the positive direction, that we would have a dynamic shift in students' lives, in the youth lives.
Yeah, I think that's great. I think we oftentimes leave young people out of the conversation about young people, right? So, because I know for me, I don't have all the answers as a professional and as a person. And you raise a great point about young people growing up in a digital space. And many of us, didn't have that growing up. We won't start talking about how old we are, but we will say that many of us, didn't have that same experience in during high school. And so we can't relate in that way, So I wanted to ask, before we open it up for questions, do either one of you have any final thoughts about how we can promote, emotional health, mental health, just overall health for young people as we navigate through this academic year that we find ourselves in? And either one of you can go first.
Yeah, I think starting to have these conversations about how we can support these kids, and recognizing that this has been a challenging time for them. Adolescence is a challenging time for everyone and has always been. And I think right now we're just sort of at this pinnacle of stress for these guys. And as you mentioned earlier on, as they get ready to go back to school, we're finding that kids are so much more anxious about being away from somewhere for so long and now having to go back and just feeling really like they're not prepared. And so I think everyone that works with youth, thinking about, what do these kids need? I like the idea of including kids in the conversation and asking them what they feel would be helpful, and being proactive about how to support these kids as they come back in real world settings. So I think, in schools, in our primary care clinics, there's a lot of work being done for screening and catching kids, before things blow up and become a bigger problem. And I think that's really a nice first step.
It was very humbling for me as a professional, as a parent, when I had to learn how to ask my own kid, what do you need? Right? Versus going, dun, da, 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 I'm going to fix it. Right? So I think that both of you raise really important points about dialogue, conversation, being open, being authentic, and really meeting children and families where they are so that we can, kind of move forward in a healthy way. Sonia, did you have any other thoughts before we turn to any questions?
I think normalizing that it's okay not to be okay. And as the adults, modeling that would be helpful to start that conversation. Because I think a lot of times we're not transparent about that with youth because we think that's not appropriate. But essentially, if we shared that today's not a good day for me, or, some things are going on in my life. And so if I'm off, it's because of those things. And putting that transparency out there, I think will open up the dialogue for youth, because then they may feel more comfortable in saying, okay, well, it's okay that I'm not okay. And they may actually want to come and have that conversation. So I think really definitely being more open and transparent about how we're feeling, and, acknowledging that there's off days for everyone, and that, I don't think I would have ever rated my emotional health as excellent because I think there's always something, right, that we'd want to do better or feel better about. So also having those conversations. I know a lot of times when for example, I had, I was working in this role, we used to use the IM40, which is like you identify strengths and 40 things you can check off as strengths. I had students acknowledge 39, 40 in their self-reports. So then
Wendy.
to my daughter, take this self-assessment.
Yes.
And she rated 19. And I said, oh my gosh, like what's going on here? So again, that perception in that self-report, and then acknowledging that, sometimes youth just don't see things as a problem because they don't think, they just are used to having to struggle or deal with things. And it's so normal that they don't realize that, no, that's actually challenging and it's okay to be not okay. So I think that's really going to be helpful and profound in moving that work forward.
Yeah, that's super powerful. That first just acknowledging it. Dana, were there any questions in the chat before we open it up to just broader questions?
There were a few questions, but they were addressed. But Annie Cease from Amy Delaware has made a couple interesting comments. She talked about needing to help parents with wellness. She also mentioned, what was it, this last one here? Modeling our own wellness as well. She made the statement agreeing to that, but there was no questions. Yeah.
Yeah, I see, Eileen, I know that Sharon shared the chapter with you on protective factors. And in general, I would say that parents, despite if you are a parent, it doesn't always feel this way, but we are ranked the highest in terms of providing our children and support and encouragement. I think it makes the biggest difference, which, again, is not surprising because of the relationships between caregivers and their young people. So, and it makes a huge difference. We get into that in the survey. If anyone's ever interested in that, we dive into, do you feel like your parents listen to you? There's rules at home, and we get into all of these different opportunities to explore the parent, and I'm using the word parent because that's what's on the survey, but parent and caregiver dyad with their child, or the child responding to the survey. And Sonia, to your point around how people are reporting, it depends on the day, right? Because some days we are out here killing it, we feel empowered, we're doing a great job, and then other days listen, it might be pizza for breakfast, lunch, and dinner, right? So we really have to, be honest and, honest about our own self. And Ms. Lisa, I really appreciate your comments around modeling wellness, but also supporting adults to learn how to support young people. I think that's super key because a lot of times we feel lost, kind of, I think, as adults, no matter our professional training, in supporting young people. And some of those evidence-based strategies, youth mental health first aid is a great one for lay folks who maybe, have some outdated thinking around mental health or distress or things. And that's a great conversation starter to start changing hearts and minds. So thank you for bringing that up. Does anyone have any questions? Any of our participants have questions, comments they want to share either with our presenters or about the data that has been shared?
Well, I do have a question. I'm going to kick it off here. Our presenters talked about trauma-informed care, and we talk about that a lot. It comes up in conversations in multiple committee meetings, different things. But I'm just curious about our two panelists. What does trauma-informed care look like to you? What does that mean for you?
Sonia, you can go first, and then we'll go to Dr. Cameron.
So I am familiar with the doctor that's leading this work. It's I wrote it down, but anyway, it's levels to it. So we start off with being trauma aware so that we're just having those conversations. We are educating about trauma, making, the finalized, just broadening the scope of awareness throughout the organization. And then you become trauma sensitive, where you're starting to put some practices in place and you're identifying better practices and how to engage. And trauma informed is when, as an organization as a whole, from leadership all the way down, you have a trauma informed lens. Your practices and your roles and how you provide services is based through that trauma lens, and you're really creating policy and expectations throughout your organization where trauma, that what happened to you is the first thought that everyone has. That when you're working with students, that's what you think first, and then you find ways to be responsive to those needs. But again, it's really about that entire organization now having that best practice under their belt and utilizing that in everyday work.
Dr. Cameron, what are your thoughts?
Yeah, Sonia, I think that was such a nice sort of overview. I think that's exactly right, that it comes down to our no-show policies, to how we respond to families when they are, have strong emotions in sessions or in the building, and just making sure that every single person in the building is thinking, okay, I have compassion for this person because I don't know what it is that they've experienced, and there probably is a good reason as to why they're acting in whatever way that they are acting, and we want to make sure that our policies are supportive of that.
I think both of you is a really great point. I mean, I think sometimes folks have the idea, I'm not a clinician, I'm not a mental health therapist, so the idea of trauma or mental health is outside of my skill set, or I can't really do anything about that. And I appreciate that both of you, have honed in on this systems piece and really the environment in which people operate, teachers and even our custodial staff and school resource officers. Everyone can be trauma informed, trauma aware, and then have, be a part of trauma responsive practices and healing centered practices. I think that's great. Were there any other questions or thoughts that people had? You can feel free to drop them in the chat or possibly unmute. We have a few minutes left to explore some different things if you'd like.
This is Sharon. I just want to thank our presenters and MJ and Dana for leading this discussion. I thought it was really very thought-provoking. A couple of thoughts that I had as I listened to it. The things that I appreciated the most about the conversation today were the concepts of the cultural humility as we approach this, and that includes being inclusive of youth and their perspectives about what they think wellness is, or what they think that is needed for them to be more healthy and to be more happy and whatnot. And I also really like I like the conversation about systems, because we do tend to individualize personal behavioral health challenges. And it's really, yes, there are choices we make and things like that, but it's true that the environment and that the people that we're dealing with and the circumstances that we encounter really contribute to that. So in my opinion, I work with Trauma Matters Delaware. You can't talk about trauma enough when you're talking about these issues. And I think when we think of trauma, we think of some kind of acute event, but I think that if we've ever needed an example of what just chronic wear and tear on the mind, body, and soul is, we can only look to the pandemic for this. I mean, it's like an onslaught every day. It might be little things that just pile up, but it certainly does have an impact. I do want to say that what I'm hearing from my teacher friends are really resonating with the national data and the things that we're seeing. I mean, the kids are not all right. I don't think they were all right before the pandemic. And maybe that's to some degree why we see weird looking data where they're saying that their mental health is really better than maybe we think it is. But I guess this is my question to the clinical folks. And that is that, you always want to respect the individual's perspective of how they're doing and how they're feeling. So if we're hearing kids telling us they're okay, is it, I mean, we ride a really thin line between wanting to acknowledge that they feel okay, and also wanting to create the opportunity for them to recognize when it's okay to feel down, to feel depression or anxiety or what have you, and to be honest about that. So I think it's an interesting point that the data shows up right here. And I'll stop now.
I guess the thing that I would say to that is a lot of times in the therapeutic relationship, we spend time doing psychoeducation so that we can kind of address educating them about trauma and letting them know that you don't have to have the classic symptoms and what, how diverse adverse childhood experiences look like and how your perception may not be that, but different behaviors that you demonstrate show that this maybe have impacted your life, and really trying to get them to start to gain insight. Because once you give them that information, then they start to do some reflection and they're thinking to themselves like, I never thought about it like that. And again, that's because their normal is different to what normal really is. So I think that's really been eye-opening through therapeutic practice for me, is just providing that information, and it reframes their thoughts. And then they start to think about different behaviors and, the people pleasing or the different trauma responses that are very clear that they live by, that's normal for them. But you're trying to teach them that that's not really, to learn something different and how to cope differently and how to find your voice, so that you're not suppressing how you feel in order to be safe anymore. And I think that was what we really worked through in our therapeutic relationship.
Yeah, Sonia, I think, everything you said is so important. And that's why I think this whole trauma-informed movement is so key, because those adverse childhood experiences become internalized and normalized, and the responses that we exhibit in response to that just become our normal, and it's accepted in the people around us. And we talk about generational trauma and community trauma, and so much of this just feels like the way to be. And it's almost like with a brief therapeutic encounter, you're probably not going to get to the heart of all of that. It's something that has to be sort of communicated widely. I know, talking about TikTok, there are so many TikToks of adults and teens and people talking about the different types of traumas and the kinds of behaviors. And it's such a crucial way of getting information out to kids from other people that they trust and feel like are telling them something that has value. And so I think we need to first get that information out, and then, give it time to sort of settle and gel and have people start to recognize within themselves, oh, this is a thing that I'm doing that might be because of these other things that happened to me. And, kids are very resilient. So I think that there are a lot of kids who are well, and there are a lot of kids who have had, tremendous adverse childhood experiences and are still okay. And just because you have some of these behaviors that maybe don't suit you all of the time doesn't mean you're not okay. And I think normalizing that is really important as well.
Thank you both. Those were, very powerful comments and statements. And I'm reminded of, sometimes in urban environments where gun violence is kind of the normal. And when you add, it's traumatizing, but in a way, many young people, when you talk to them, this is just the way that it is. Like, this is just how I live. This is just my neighborhood. And so if you ask them, are you scared? At some point it almost becomes kind of this way that it is. That's just, no, I'm not scared because this is just the way that it is. Another person I know died by gun violence. It's just the way that it is, which is, heartbreaking in and of itself. And then, so how do we empower them to move forward into healing spaces and remain resilient? Because that's the most important piece is remaining resilient. All right. Any other thoughts? Any other comments, questions, challenges to the data? Anything? Well, in the meantime, before I forget, I am going to drop the evaluation link in the chat, and if you'll take some time over the next few days and fill it out, that would be great. I appreciate you for that. I also appreciate Dr. Camerata and Sonia Songi joining us, Ms. Messick. I got a message from her on the side. Apparently her building lost power, so there was no power in the office. So I will check in with her, but I do appreciate your thoughts and your wisdom and your insight. And I also appreciate you doing this work day in and day out, and being champions for young people and their families in the state of Delaware. It looks like Ms. Collins has dropped some information about youth mental health first aid or teen mental health first aid. If you're not familiar with those programs, they are really interesting. It really, again, raises that awareness at the community level for quote lay people or folks who don't do this work. And then teen mental health first aid is really powerful because it's young people and empowering young people to talk to other young people. Because if sometimes young people don't listen to grownups. And sometimes that information has to come from another teen to really turn on, to really click in and be like, I get it now. And so when we empower young people and raise awareness around these issues, we are doing more than just impacting that one young person. We're actually kind of setting the stage to saturate environment with awareness and information and compassion and empathy. That's the other piece, is compassion and empathy. If there are no other thoughts, I want to thank everyone for their time, and to learn more, what we'll do afterwards is we'll send out the slides, we'll send out the recordings. Sonia and Dr. Camerata, if you want to drop contact information in the chat, you can, please do. We will send out some of these resources that are in the chat and connection information when we send out the slides. So if there's nothing else, I want to thank everyone for their time. Please stay well. Looks like there's more information from Annie Sleece. She's a powerhouse when it comes to psychoeducation in Delaware. I really appreciate her efforts. So Dana mentioned it at the top, but in January 2021, we will have our semi-annual SEOW meeting. Please keep an eye out for that information, and we will make sure you get the sign-in and the registration and all of those other things. It will be late January, as we always do. So thank you so much, everyone. We appreciate you. Dana, any final thoughts, comments, anything?
No, thank you. I really appreciate this, and it was a great conversation.
All right, thanks so much. Be well.
Bye.
Thank you.